the collaborations within the MEDRC work very well, frankly because we require that a visiting scientist come to MIT. You know, if you had many different models, many different ways of collaborating with industry. But instead of just delivering a report once a year or once every 6 months, but that somebody from the company can be seeing and actively involved in the research that we're doing. And MIT is an open university, so once you're here as a visitor, you get to establish other collaborations. You get to see what other people are doing and be more integrated into the ecosystem here. So, you know, the MEDRC projects are very significant. They're 10 man-year type activities, 10 student-year activities, so 3 students per year for 3 years. So, you know, the numbers are not small. But the return on investment, if you will, for the company is significant in that obviously you can leverage the research that's being done, but then the ancillary additional benefits that come from having a visiting scientist here involved with us. One of the companies that you know, we're talking with right now is Air Liquide. So I'll bring them up as an example. So companies such as Air Liquide, Novartis, Genzyme, the drug and pharmaceutical companies. One of the opportunities that we see with the MEDRC is to, you know, we've been very focused on devices, but bringing devices more into clinical trials for drugs and more into the drug delivery process. So companies such as Novartis have articulated an interest in 2 significant areas. One, to have better enrollment data or better compliance data for their clinical trials. So if you can get technology into the home that allows you to know that somebody's taking the drug or doing what they're supposed to be doing, or just getting better data in the context of daily living in the home, that's of significant value to the companies. But then the next phase of that would be, well, how do we use sensory data, whether it be imagery or physiological monitoring that's acquired 24/7 in the context of daily living? How do we better use that to titrate the medication, to put the feedback loop around how medicine is delivered, monitored, and complied with? And so that's maybe a little bit far-reaching in terms of we don't have an active collaboration in that space just yet, but we see it as an area that we will be growing. But I think the reason that the MEDRC is successful is we spend a lot of time making sure that the collaboration works. We have a visiting scientist here, and that myself and Charlie Sudini and Joel Voldman, we sort of speak both the academic language and the industry language. And the reason that the Master of Engineering and Manufacturing program works is that it's you have somebody, so myself for the first 7 years, and now Jose Pacheco as the Associate Director, that loves, embraces, and makes sure that we have the conversation with the faculty advisors and the industry supervisors, and being able to, again, straddle that line between academic needs and industry needs.